I would like all of you to take your seats. And because it's a workshop, we will be quite informal and we will be pushing each other. Uh, we will try to make it interactive as much as possible. So as I said in the inauguration part also, that nephrogenetic or genetic is something that I am really afraid of. Even in my MBBS days, my grasp of genetic stopped with autosomal recessive and autosomal dominant, and that also I found it very difficult to understand. But unfortunately, we cannot avoid genetics nowadays, and in future, I think everything will be genetics. So we have to learn. And adult learning is a very difficult and slow process, but the plus point about adult learning is that if you feel it will be useful, then you will learn. Then you learn more quickly. And we are now really feeling that we need to have some knowledge of genetics in our day-to-day practice. What we have done for the workshop is that the first 4 sessions or so will be didactic session. We have got 4 lectures. Obviously, you can ask questions in that, and that is sort of will be making the ground for the subsequently. Then we will come to the most difficult part of our workshop, that is an interactive group-based discussion. We have had a lot of debate on how to do this group-based discussion. We means like me, Dipanjana, Debolina, and our advisors including Anil, Mordi, and Asita, and Kausik. I can't see him. Is he around? He's around. So how to do it? So ultimately, I think we have left it to Dipanjana to decide how to do it. And I mean, ladies are ruling the world nowadays. So I'm sure she will do a fine thing. But I've been getting queries from various consultants about like, kya hone wala hai? What will happen in this? And we are not expected to answer any questions. All questions will be answered by Dipanjana, Asita, Anil, Modi, these 4. Okay, so don't worry. We are not expected to answer any questions. We are expected to ask questions. So in that note, we come to the post-lunch. Post-lunch it will be again basically case-based discussions. We have included a few cases from our nephrogenetic clinic. We are having a sort of an online nephrogenetic interactive session every month, which have been stopped for the last 1 month because of this ISPN con business. And we means like from our side, me, Devlina, and Dipanjana, and from their side, Mordi and Asita. We sort of meet online and discuss cases, and then we pass it on to the patient so that the family can get some benefit of it. So we have selected few cases from that. Then a couple of cases has been from outside also. Anil has contributed 1 case, and if we go on time, which we are at the moment on time, then we will have a specific session where you can bring up your cases also briefly, to get opinion from the 4 experts, and by that time maybe all of us will be also a bit of an expert. So I would invite Dipanjana Di to start the session. Thank you.